Across the country, tackling the topics everyone is talking about online. Share, engage, and interact. This is Newsfeed Now.
Good Wednesday morning, everyone. I wish you could come in real close because I got a secret for you. You're halfway through the work week. Congratulations. And thanks so much for joining us for Newsfeed Now. I'm Hillary Hunt. Let's take a look at some of the stories that are trending right now. Of course, we have to start with talking about the COVID-19 pandemic, starting with the latest on that front. The CDC is changing its recommendations on the length of COVID-19 quarantines. The agency now says you only need a quarantine for about 7 to 10 days after close contact with someone who has the virus. That's down from that 14-day recommendation. You can come out of the quarantine after 7 days if you get a negative test, or 10 days if you don't get tested. And as always, it's super easy. Just wash your hands, wear a mask, and continue to social distance to protect yourself. And listen to this, a 14-member advisory panel voted Tuesday on who should get the COVID-19 vaccine first. Anna Warnicki's in Washington with more on that for us.
Kathleen Dooling, a member of the committee advising the CDC, says the first doses will go to healthcare personnel and long-term care facility residents.
Essential workers who do not work in healthcare in phase 1B, and adults with high-risk medical conditions and adults who are 65 and older in phase 1C.
The decision comes just days before FDA advisors are scheduled to discuss the emergency approval of the vaccines made by Pfizer, BioNTech, and Moderna. Dr. Sarah Oliver, another advisor on the committee, says the plan is to start distributing the shots within 24 hours of that approval.
We expect a constrained supply environment for some months and need to make the best use of available vaccine.
Ultimately, the states will decide who gets the vaccine first, but the vote today will help the governors make those choices and start setting up the process for administering shots. Health and Human Services Secretary Alex Azar says 40 million doses of the vaccine will be available by the end of the year, enough to vaccinate 20 million Americans.
That won't all be available at the same time, however. We anticipate 5 to 10 million doses per week post-authorization.
The CDC says states have until Friday to submit their orders for vaccines. That gives federal officials time to evaluate their plans ahead of the expected FDA approval on December 10th. In Washington, I'm Anna Warnicki.
Well, let's talk about a coronavirus relief plan. A bipartisan group of lawmakers just introduced its own relief plan with a promise that Congress won't leave for Christmas until a compromise is actually reached this time. The proposal includes more money for the unemployed, struggling small businesses, as well as state and local governments. Here's our Jesse Tuner.
This is a victory for the American people. This is a victory for common sense.
This bipartisan congressional group says it's coming to the rescue before key coronavirus relief programs expire at the end of the year.
We're actually meeting the human need.
While the $908 billion package does not include another round of stimulus checks, Republican Senator Bill Cassidy argues the emergency relief will go to the neediest Americans, including more funding for small businesses, unemployment insurance, and state and local governments.
Republicans and Democrats, neither of us got everything we wanted. Both of us got much of what we wanted.
The plan also includes a GOP priority, a temporary federal liability shield from coronavirus lawsuits, which had been a sticking point for Democrats like Senator Joe Manchin.
We acknowledge that federal liability has to be one of the things we consider and do and make sure we do it right.
Now the group has to convince House and Senate leadership that the benefits are worth the political compromise.
We're hearing from members across the spectrum that they want to get something done before we go home, and I think that pressure is going to really get this to the floor for a vote.
While Democratic Congressman Josh Gottheimer is hopeful of Speaker Nancy Pelosi budging, Republican Senator John Kennedy blames her for the holdup.
Until I see her show a willingness to get out of La La Land and be realistic, we're not going to have a coronavirus bill.
In Washington, I'm Jesse Tenor.
Thanks, Jesse. Let's stick with talking about what's happening at our nation's capital. The Justice Department is investigating a bribery for pardon scheme. Now, the federal court documents that were released are heavily redacted and don't name any of the people actually involved. They also don't indicate if any White House officials had knowledge of what was happening. The investigation involves an allegation offered by an unnamed person to offer substantial political contributions in exchange for a presidential pardon. And we are your local election headquarters. Attorney General William Barr says The Justice Department has not uncovered evidence of widespread voter fraud in the 2020 presidential election. In an interview with the Associated Press, Barr said the department did not see wide-scale fraud that would have actually changed the outcome of the presidential election. Barr directed U.S. attorneys across the country last month to pursue any, quote, substantial allegations, end quote, of irregularities in voting before those votes were actually certified. The Trump campaign's legal team, as we know, responded to Barr's comments by claiming the Justice Department has not had substantial investigations into voter fraud complaints. And guys, we're hoarding TP, we're doing all the things, but we are forever indebted to our healthcare workers. They are so awesome. That goes without saying. This has been an impossibly grueling year for them. The country is experiencing a shortage of nurses during this pandemic for a wide variety of reasons. And as you know, hospitals across the country are competing to get them back to work. Marky Martin has more.
It's the shortage being felt around the country, the desperate need for nurses in hospitals on the front lines.
Monica, you have family on line 1.
It's exacerbated by this pandemic.
While the government currently has no concrete numbers on what the shortage actually looks like, anecdotal evidence straight from the source points to the severity of the need. Integris Health is one of the largest hospital systems in Oklahoma. On its jobs listings page, more than 350 open nursing positions wait to be filled. The hospital now offering a $25,000 signing bonus to those willing to work.
And that's the best way to try to attract nurses to our state.
Dr. George Monks is the president of the Oklahoma Medical Association. He says his state, like many others, already had a nursing shortage prior to the pandemic. And since the COVID outbreak, 7,000 Oklahoma healthcare workers have contracted the virus.
When you go into this having a shortage and then you have nurses that are isolated or in quarantine because there's so much community spread of this virus, it takes a toll on our ability to deliver health care.
One Wisconsin-based hospital also offering its candidates a $15,000 signing bonus. And in North Carolina, the pandemic is placing added strain on the decades-long deficit that already existed.
Most people are prepared to be asked to work longer hours, more shifts.
We spoke with Dr. Brittany Bankhead Kendall, an ICU doctor in Texas. She says this current workload is not sustainable. More prevalent than we know is the resignation of frontline workers during what's been a traumatic year.
Probably a lot of them feel a little bit of shame and guilt for leaving and for the time when the team needs you the most for having to take their exit, and rightfully so, for their own selves, for their health, for their own families.
She says money in the form of these competitive signing bonuses is the only way to appeal to nurses in such a trying time for hospitals.
And it's enticing, it really is, and especially for a new nurse and starting out, and you've got all these student loans really need to be paid off. You don't know what healthcare is going to look like over the next few years.
Truly do appreciate our healthcare workers. They really are superstars during this pandemic. But let's keep talking about the pandemic. Something that is not making you a superstar is when you were stockpiling all that toilet paper. Guys, it's happening again. This is like the third wave of people starting to hoard those household supplies. Come on. Everyone needs a TP. Nearly 87 million Americans are stocking up on toilet paper, hand sanitizer. An additional 35% plan to stockpile, but haven't started yet. Almost half of Americans said they somehow went to a store and there was nothing there because they were trying to purchase something during that big first wave when the coronavirus hit. You know, everyone just cleared all the shelves. Look at those empty shelves. Oh gosh, come on guys. They're struggling just to keep those things on the shelves, but sharing is caring. That's what my mom always says. Well, let's move over to Louisiana. A man battling COVID-19 was able to receive help from all the way across the country, and it all started with a post from his brother-in-law. Dan Jovick has more on this story.
It's an amazing story of a network coming together to save a life.
A story which begins with a call for help made by recently retired Navy SEAL Commander John McCaskill. In early November, his brother-in-law Ryan came down with COVID. He was in need of convalescent plasma, something the hospital in Ruston could not provide.
He ended up getting life flighted to LSU Shreveport from Ruston almost 2 weeks ago now.
Ryan received the plasma treatment in Shreveport and was making progress. Last week, that changed.
12:45 a.m. the Wednesday before Thanksgiving, I get a call from my sister, and Ryan has taken a turn for the worse. And he needs to be put onto a machine called an ECMO machine.
The machine infuses oxygen into the blood. Due to the recent surge in COVID cases, many of the ECMO machines at Ochsner LSU Health were in use. John wanted to make sure an extra one was on hand for his brother. That's when he made the call.
I put a picture that just said, "Help me," on LinkedIn, and the story of where we were at the time.
His special operations and professional network responded.
I mean, it spread like wildfire. Hundreds of thousands of people saw it within that first day.
It had a medical transport company out of New York City locating an ECMO in New Jersey.
As we located a machine, I updated the post, and then people were, "Do you need air transportation?" Ended up locating a flight.
Within hours, the machine was on a plane, making the nearly 1,400-mile flight to Shreveport.
It flew into Shreveport that evening, and as soon as we found out that we had a machine and we had a flight, then Ryan was able to be put on the ECMO machine.
All of this happening on the busiest air travel day of the year.
It was a timely miracle in that it was the day before Thanksgiving.
Ryan's condition has stabilized, but he's not out of the woods. John knows Ryan will continue to fight, as do the thousands who recognize John's call for help.
And it has restored my faith in humanity, for sure.
And Dan Jovick, he's joining us from Shreveport, Louisiana. And Dan, just talk about the power of social media here. It was one post and it grabbed so much attention. He actually got the machine. It's amazing.
Yeah, it really is, Hillary. This post, according to John, was seen over 100,000 times in one day. Now, his background does have something to do with it. As a former Navy SEAL commander, this man has a reach not only in the United States, but he has a reach globally due to his time served in our armed forces. That helps, of course. But humanity helps as well, because a lot of people reached out to him that did not know him, and they offered their services, and people are doing so on the website that he set up to help raise some funds for his brother-in-law and his sister. Anonymous people are donating right now, and that's ultimately what John wanted to do, was to save his brother's life and then provide them some financial security moving forward, since his sister Sharon can't work while his brother-in-law's in the hospital.
And you know, this also shines a light on the fact that hospitals are so overwhelmed right now, that equipment is so few and far between because so many people are coming down with this virus. And, you know, it just shows the need for equipment and the ability to, I guess, you know, get it if you really push yourself, because all he did is he said, "I'm going to try." All you can do is try.
Yeah, well, I mean, he's a Navy SEAL, right? I mean, where there's a will, there is a way, and those guys are the testament to that. And yes, to your question and to your point, it's exactly right. I know I talk to a lot of people in the community who do not believe that our healthcare workers are overwhelmed. It's because they don't see it every day, because you can't get into the hospitals, and because of HIPAA laws, they can't discuss specifically what is going on with their patients in their hospitals. This is proof positive that a man needed a piece of equipment that at the time was not there. So John took it upon himself as a Navy SEAL and delivered for his brother. And he spoke to that with me off camera, saying, "Hey, I don't want to get political with all of this, but I know it because my sister's an ER nurse, and I know it because my brother is in the ICU unit needing this machinery. That hospital is overwhelmed, and many others in the United States are as well."
Perfect. Thanks so much, Dan. And of course, our thoughts are with Ryan, who's in the hospital, and the millions of others that are suffering from this virus right now. Thanks so much, Dan. And now we want to give you a daily dose of holiday cheer. Members of Congress will come together to participate in the lighting of the U.S. Capitol Christmas tree tonight. And boy, this is a big boy. The tree is 55 feet tall, but what a beauty. It's from a national forest in Colorado. It will be lit from nightfall until 11 p.m. each evening through Christmas. If you need a smile, the United States Forestry Service said the tree was actually selected virtually because of the pandemic, a first for everything. And how cool is this? That tree is going to be decorated with ornaments created by people who live in Colorado, where that tree actually came from. And come on, guys, let's stick with the trees, because you know I love a real Christmas tree. The 88th Rockefeller Center Christmas tree will be lit tonight and on display through early January 2021. Oh, I love that tree. I see it every year, but not this year. Although the tree lighting will be closed to the public, the ceremony will be broadcasted live so you can watch it from your couch. Put on those Christmas jammies. This year's tree is 75 feet tall. It's a Norway spruce tree with more than 5 miles of lights. Holy guacamole. Those who want to get close to the tree, you actually have to make a reservation this year, but as someone who is a tree fanatic, it is worth it. So make that reservation. That tree is going to be lit from 6 a.m. to 12 a.m. daily, so you got plenty of time, but you got to lock in that reservation. But before we go, I swear this is the mystery of 2020. We've had a lot of them, but this one, similar to the one recently seen in Utah, a metal monolith appeared on a hilltop in Romania last week. Then what do you think happened? It disappeared. This video was shot Friday on the hillside in Eastern Europe, in the Eastern European country. But guess what? It was gone by Tuesday. What is happening? The pillar in the Utah desert was discovered about 2 weeks ago. You remember that one, the 9-foot tall one. It appeared to have been made in pieces, welded together. Police said officers are investigating this case because the metal pillar was illegally installed. But I mean, what is happening? Who's installing these? Where are they going? I'm going to get off this show because I need to go Google this. I need to find where the next one's going to pop up. Maybe it'll pop up here in Little Rock. I don't know. You got to stay tuned tomorrow to find out. Thanks for joining us for Newsfeed Now. We'll see you right back here on Thursday tomorrow. Have a great day. Go find the monoliths.